Lease for just $259 per month. Shop ChooseNissan.com.
A new school year, of course, just around the corner, and among concerns for schools and families is bullying.
Ending bullying is a national effort and one that's being tackled by the mayors of Akron and Cleveland. But as News Channel 5 anchor Lee Jordan shows us tonight, sometimes parents are compelled to take drastic action to protect their child.
Like, it was huge.
When Samantha Daniels was a baby, she was dimpled and adorable. And like a lot of babies, one feature was a little out of proportion.
Her ears were big. Her dad and I noticed, but we never said anything. And, we would always kind of say she'll grow into them someday.
But as Samantha grew, so did her ears, and they began to cause problems.
She would cry when we tried to put a bike helmet on her. It would hurt her ears so badly.
Susan Daniels said bigger trouble came later at school.
Fourth grade. Fourth grade is when she had come home and said, they're starting to talk about me at school. They called me monkey ears. They're calling me Dumbo. One kid said she had freakishly large ears when she was in fifth grade. So it started to affect her. How did that make you feel?
I hated it because I thought that, it didn't matter. I thought that my ears looked fine until people started making fun of me.
She used that word. She came home and said, I know I'm being bullied, and it hurts. And I wanted to stop.
Samantha's parents knew it was time to pursue ear pinning surgery called bilateral otoplasty.
When we walked into Dr. Lakin's office, and he said to her, Samantha, why are you here? She said, I'd like you to fix my ears, please. And he said, that's what I wanted to hear. I wanted to hear it from her, and not you, Mom, and not you, Dad, her.
Dr. Gregory Lakin is Chief of Plastics at Rainbow Babies and Children's Hospital.
Samantha is a beautiful young girl, but you didn't notice how beautiful she was because she had such severe ear deformity. It was as severe as they come.
But the surgery was meant to address more than the physical problem.
We knew as a growing girl, self-image is really important, and this was affecting how she felt about herself. She was becoming quiet. She wasn't, as outgoing. This was affecting who she was, and we didn't want that to get worse, and we knew that was the path she was on.
1 year ago, Samantha had the surgery.
The day that we had the reveal, she took the cups, they took the cups off and the bandages off, and she saw herself for the first time. She was very emotional because she wasn't, used to seeing herself like that.
I felt beautiful, and that's what I really wanted. That's why I did the surgery, because I wanted to feel better about myself, and that's exactly what happened. So I was very happy with it and very emotional.
Lee Jordan, News Channel 5.
And we asked you to weigh in on this story today on our website, newsnet5.com. The question, assuming you could afford it, would you allow your child to get plastic surgery to stop bullying about their physical appearance? 62% of you said no, 38% said yes.
And Chris, speaking of bullying, a pair of sisters who endured years of taunts for their red hair have now used it as fuel to form a booming business. Stephanie and